What is the Affordable Care Act, Obamacare? The Affordable Care Act, ACA, commonly known as Obamacare, is a comprehensive health care reform law enacted in the United States on March 23, 2010, under President Barack Obama. The primary goals of this law are to expand health insurance coverage to more people, reduce health care costs, improve the quality of care, and eliminate barriers that prevent people from accessing health insurance, such as pre-existing conditions. Before the ACA was introduced, tens of millions of Americans were uninsured. The health care system at that time was considered both expensive and inefficient, while millions of people were unable to access necessary medical services due to high costs. The ACA was designed to address this issue by establishing health insurance marketplaces, where individuals and small businesses could compare insurance plans and receive financial assistance from the government if they qualified. These subsidies include tax credits and cost-sharing reductions to help lower the financial burden on low- and middle-income individuals. One of the most notable features of the ACA was the individual mandate, which required all Americans to have health insurance or face a financial penalty, though this provision was later repealed at the federal level in 2019, but still applies in some states. The law also prohibited insurance companies from denying coverage or charging higher premiums to people with pre-existing medical conditions. Insurance plans were required to include 10 essential health benefits, such as preventive care, emergency services, maternity care, mental health treatment, and prescription drugs. The ACA also expanded Medicaid, the health program for low-income individuals, by allowing more people with slightly higher incomes than previously allowed to qualify. However, this expansion was optional, and not all states chose to adopt it, resulting in significant differences in Medicaid coverage across the country. In addition to expanding access, the ACA included reforms aimed at improving the efficiency of the healthcare system. For example, it encouraged the use of health information technology, promoted value-based care models, paying for quality rather than quantity, and invested in disease prevention and public health education programs. Despite its positive intentions, the ACA has been the subject of much controversy. Supporters argue that the law was a major step forward in ensuring health care access for all Americans, especially those with low incomes or chronic conditions. Opponents, mostly from the Republican Party, claim that the ACA increased insurance costs for some groups and placed financial burdens on small businesses and taxpayers. Since its enactment, the ACA has faced numerous legal and political challenges, including attempts by Congress and the Supreme Court to repeal or amend it. Nevertheless, many of its key provisions remain in place, and it continues to play a central role in the U.S. healthcare system. Notably, during the COVID-19 pandemic, the ACA proved its value by helping millions of people who lost jobs and health coverage to access insurance through ACA marketplaces or expanded Medicaid. To date, the ACA has enabled tens of millions of Americans to gain health insurance for the first time in their lives. While there is still room for improvement, the law is considered a landmark achievement in U.S. healthcare reform. It has not only changed how people access medical care, but also sparked a broader discussion about the role of government in guaranteeing health care as a fundamental human right. In conclusion, the Affordable Care Act, or Obamacare, is more than just legislation. It is a symbol of a systematic effort to improve fairness, efficiency, and quality in American health care. With its far-reaching impact on millions of people, the ACA will continue to be a topic of debate, revision, and influence in the future of U.S. healthcare.